Juan, you have been 26 years in the area of research how to supplement arginine to patients who really need it. You're a trauma surgeon. So tell us, what is the patient cohort who most would benefit from this supplementation?
So certainly where the level 1 evidence, the best evidence of benefit exists is in patients undergoing elective surgery. That is surgery that is planned. In those patients, taking arginine along with omega-3 fatty acids, with fish oil and nucleotides will, particularly if we started prior to surgery, will be associated with a risk reduction of infections of about 40 to 60% in those patients.
But trauma surgery is not always elective. It comes in the night, 2 o'clock in the morning. Are those patients also benefiting?
That is true. And trauma surgeons are also general surgeons. So we do both elective and trauma surgery. Trauma patients are also benefited, but obviously we cannot start it prior to the accident. So we have to give it after surgery. And as long as we start it early and we give enough, there is an associated benefit.
What is the health benefit if you supplement with arginine? What is proven?
The biggest benefit that we see is in 3 areas. One is the risk reduction of infections, so people get less infections after surgery or trauma. The second one is improved wound healing. And the third one, which is a little bit more difficult to measure, but is improved microcirculation.
You have described the so-called arginine deficiency syndrome, which goes beyond surgery. What kind of disease states are you thinking about?
So what is important is to understand that arginine becomes deficient in our patients because of increased destruction, and we have to supplement it. So what we have found is a number of illnesses where we have observed increased destruction, and therefore they have a nutrient deficiency. And ideally, these diseases should benefit from supplementation. They include certain cancers, like, for example, renal cell carcinoma. They include certain infections, such as tuberculosis, for example. They include certain diseases, such as sickle cell anemia, possibly asthma, possibly patients with severe infections.
Final question. How do you supplement with arginine? Is this part of formulas?
Yes, it is. And it is really important that arginine, the biggest benefit that we see is when we give arginine along with fish oil, which we call omega-3 fatty acids, and along with something called nucleotides. That mixture in a supplement that is nutritionally complete is very important for all our patients.
Okay, thank you very much.
Thank you so much. Appreciate it.